If you break your nose and you're worried about how it's gonna look afterwards, which most people are, the important thing is to make sure you're breathing okay and that you don't have any other injuries or what have you, and then you have time to allow things to the swelling to go down for a few days or a week potentially, so you can call, find your provider, and still have time to get it addressed within the first couple of weeks, but it's not an emergency, must be seen tonight kind of thing. Oftentimes, I have primary nasal fractures go to the ENTs around and have them set, and they can evaluate the septum and the airway and all of those kinds of things. If they just are worried that they're swollen and is it going to look okay, but they're breathing fine and it doesn't look that different, then they can allow it to settle down. And then I'll see them after a few weeks when the swelling has started to go down. But if they really have a significant fracture, I do usually refer those to an ENT. The difference between repairing a nose that was just fractured and one that was fractured years ago is that a recently fractured nose, basically, you can realign and splint and maybe do a few things to kind of line up the bones as they were shaped before the injury. It depends on the severity of the fracture, but in general, you can kind of line up what was already there. If it's healed and has been healed for years, it may have healed with a depression or something where now the bone is not straight as it once had been. It is actually a curved bone. And so correcting that is different. It has remodeled, it has set itself. And so you're trying to straighten a bone that is actually potentially curved, whether in or out or one of each. And so that's where the main difference is in coming back to address it down the line.